Hi, this is Dr. Jenny Byrne. Today I wanted to take a minute and talk about emotional intelligence and how, as a leader or a professional or a physician, that you can cultivate this if it may not come naturally to you. So many people have asked me over the years, are you naturally an empathetic person? And normally it surprises them to know that I actually had to work at developing empathy. I have empathy, but it was a skill that I really had to learn. And fortunately, in my psychotherapy training as a psychiatrist, I was able to learn from some great folks. But you don't need to be a therapist to have high EQ. So, what are some practical ways in which you as a leader can cultivate EQ? I would urge you, if you are not someone that this comes naturally to pause and first of all understand the motivation for wanting to have EQ. So, EQ is important because humans often behave based on emotional states rather than logical thinking. We may sound like we have logical reasons for doing what we do, and we may sound like we understand our own motivations, but often our behavior is dictated more by our emotional state than our rational thought. And after the fact, we will use our rational thought to rationalize why we did that thing. But if you dig down, a lot of it is driven by emotions, which is actually quite helpful because as humans, emotions are a shortcut to making decisions. If we had to rely on rational thinking alone, we would rapidly get bogged down in all of our thoughts and we would not be successful. So, emotions are not a bad thing, but it does require some insight. So, how can you cultivate EQ now that you know why it's so important? I recommend for most folks, if this does not come naturally to you, to start with a type of cognitive empathy. So, cognitive empathy is basically putting yourself in someone else's shoes. So, you don't have to emotionally feel the way that person does, but you are going to use your thoughts and your cognition to try to understand what they may be feeling. And if you really struggle with this, as some people do, you may actually need to learn a little bit about facial expressions and how to read particular facial expressions. It might also be helpful to you to learn about some of the most common human biases that we operate on, which have emotional underpinning. So you can read about these biases if you read about behavioral science. And there's a company I'll put in the comments called Irrational Labs that does a really nice job of describing this. You can learn about human biases. You can also try to just put yourself in somebody else's shoes and try not to make assumptions. So if you don't know how somebody else might be feeling, find a way just to ask. Like, I don't know what it's like for you. And maybe you could say, I'm imagining you may be struggling with this, but I don't know. You'd have to tell me. So, practicing that empathy skill and asking questions in a curious, non judgmental way will help you better understand what someone else is going through. Honestly, that's the first step. If you would just be able to do that and get out of kind of closed mind thinking about assuming other people are doing things for the way you would want to do them, that's almost half the battle. So I would really focus on being cognitively empathetic first to try to understand what somebody is going through. And if you don't know, ask open ended questions. That's honestly the first step. If you can cultivate that, you're halfway there. I know it's not always easy, but it can be done. Hope this was helpful.